So, my overall vision for this journal is to really address the unmet need, and that is what we're really dealing with is a shifting paradigm of adult cancers happening in younger and younger patients. And so, going through the spectrum, of course, we have pediatric oncology and those diagnoses, and we're going to really want to focus on that. But I really want to touch on both the unique needs of the adolescent and young adult population and the shift in these older onset cancers that are happening now in that AYA community. So, currently, there really is very little out there that focuses on the unique needs of this adolescent young adult population. And in that regard, I'm not just talking about, the actual medical aspects of the therapy, but then just thinking about, once you treat these patients, what does survivorship look like? And again, that's very different than what we're thinking about just for purely pediatric diagnoses as well. What are we thinking in terms of psychosocial aspects to their care and how do we optimize it? And then, of course, what are the unique considerations and the other toxicities that we often don't spend too much time on and thinking of in terms of the AY population? That could be what happens when you're missing colleges or financial toxicities. What about if you have dependents that you are responsible for as opposed to you being a dependent? And then, of course, just the transition of care that happens very naturally from childhood to adolescent to adulthood, and then having a cancer diagnosis put on top of that, and how do you navigate that throughout the rest of your life? I think that this journal, especially in the framework of the American Cancer Society, will really help to put attention on some of these issues so that we can, as a community, think about how do we optimize outcomes for this very, vulnerable population.